Hello everyone. You are watching sqadia.com and I am Hammad Haider. Today we'll be discussing briefly about the fractures around the distal radius. We will have 5 sections. In the first section we will be discussing what is Colles fracture, what is its mechanism of injury and pathological anatomy, its clinical features, its imaging and its treatment. In the next section we will be going through the undisplaced and displaced fractures, in which the first we'll be discussing the undisplaced fractures of the distal radius, their management, and the next section we're going through the displaced fractures of the distal radius and how we can deal with the impacted low energy distal radius fracture, especially in the case of osteoporotic women. Thirdly, we'll be going through the Volar displaced fracture or fracture radius styloid, that is another entity called as Smith fracture, and the radius styloid fracture. We'll be briefly discussing them and their treatment and the management. In the fourth, we'll be discussing the intra-articular comminuted fractures. As with the distal radius, we can have a simple transverse fracture, we can have a simple fracture which is communicating an intra-article extending into articular surface, called as intra-articular extension, or it could be a comminuted intra-articular fracture. And then lastly, we'll be discussing the distal forearm fracture, that is the fracture of the metaphyseal area or a metaphyseal diphyseal area of both the radius and ulna, especially in the case of the children. We'll be discussing their mechanism of injury, their clinical features and x-rays, especially the certain fracture types and patterns such as Saltarius fractures, especially the type 2, green stick and torus fractures in the children. Thank you very much. Keep watching sqadia.com.